Hello, my name is Jakob from ETH Zurich, and this presentation is about our work titled Predicting Early User Churn in a Public Digital Weight Loss Intervention. This work focuses on a digital health intervention, which are electronic health services that are nowadays predominantly delivered via mobile apps, with an emphasis on promoting healthy behaviors. And these tools have demonstrated potential in assisting users and healthcare systems with the global increase and rising costs associated with noncommunicable diseases, which are the leading cause of death and disability worldwide. One significant challenge digital health interventions face, however, is sustaining user engagement, with many users not adhering to them as intended. Particularly user churn, also referred to as dropout or attrition, whereby users fully disengage prematurely, jeopardizes the potential long-term health benefits these tools could provide. Studies have also shown that churn is most pronounced in the initial week of usage, and thus identifying at-risk users early on and preventing them from churning is a critical concern for improving digital health interventions. And this may be realized with churn prediction, a specialized domain within data analytics whereby machine learning algorithms are applied to detect users likely to churn, for example by utilizing app engagement data like users' daily login counts as input. And if these predictions are accurate, they can provide actionable insights for the delivery of targeted interventions or system adaptations to potentially change the engagement trajectory of a user. A small but growing body of research studies indicates that churn prediction in digital health interventions is feasible, with high prediction accuracies reported in various health applications. However, there's a considerable variation among these studies regarding applied machine learning algorithms, the input variables, also referred to as features, and model dimensionalities, which refers to the number of features that a model learns from. Also, existing studies mostly focused on predicting churn at one specific point in time, usually after the initial week of usage, when a substantial amount of users has already fully disengaged. Another significant research gap is the absence of studies examining the number of users who re-engage once correctly predicted by churn prediction models, and therefore it remains somewhat unclear if machine learning algorithms can actually detect users before they disengage, or if they simply give us a timely estimate of already disengaged users. And this information is crucial for assessing the potential of in-app interventions or timely adaptations of behavior change systems to then retain users. To address these research gaps, we evaluated churn prediction models in the publicly available and subscription-based weight loss app Wellbeing in the initial week of user interaction. We were interested in which machine learning algorithms are most effective in predicting early churn and how the predictive performance develops across the first 7 days of user interaction. Given a previous study reporting promising results only using daily login counts, we adopted this approach and also compared the results with higher dimensional models incorporating additional features. We also conducted feature importance analyses to investigate which features are best suited to predict early user churn. And finally, to assess the potential for targeted interventions, we also examined the number of users who remained active in the app once correctly predicted to churn by our models. The dataset comprised data from more than 1,200 users and contained static user attributes such as users' weight, as well as clickstream data totaling more than 400,000 app event log entries. The app offered us an interesting use case to study early user churn because it utilizes a trial subscription model with the necessity for users to actively unsubscribe, offering us a clear churn indicator and thus providing a more accurate measure than relying on user inactivity after some predefined period. This procedure also led to a natural pre-selection of users with a sincere intention to use the app compared to studies in free publicly available apps. In this study, users were categorized as churned users if they canceled their subscription within the initial 7-day trial period or if they requested a refund within the first 14 days of a paid subscription. Conversely, users who maintained their subscription were categorized as retained users. As our objective was to understand differences in model performance based on the dimensionality of features, we created 3 model dimensionality categories: low, medium, and high. For low dimensional models, we solely incorporated the number of app logins per day. This feature selection was inspired by the work of Bricker et al., who reported high prediction accuracies into smoking cessation apps after the first week using only this feature. Medium dimensional models also included users' minutes spent in the app per day, unique app events per day, and the total number of app events per day to include a broader perspective on user engagement. Additionally, we included the user's weekday of install, user weight, and user acquisition type, given that prior studies have linked these static features to variations in user churn. Lastly, high-dimensional models were the most comprehensive. They further incorporated features detailing users' daily minutes spent in each app event per day. And in comparison to other engagement features, these features also include information on the specific app components users interacted with. For example, how many minutes did a user interact with their activity plan? To predict churn for all three model dimensionalities on each of the first 7 days of app usage, we applied multiple machine learning algorithms, including logistic regression, decision trees, random forest, support vector machines, XGBoost, a feed-forward neural network, Bayesian logistic regression, and an ensemble method. For model training, we randomly split 80% of the dataset into a training set and the remaining 20% into a test set. For all models, we applied stratified tenfold cross-validation and randomized search for hyperparameter tuning on the training set, optimizing for F1 score. We also applied Tomic links undersampling to ensure an even distribution of churned and retained users. And finally, we evaluated models using F1 score, area under the curve, accuracy, precision, and recall. Looking at the model performance results, a consistent trend emerged with F1 score increasing as trial days progressed, which was observable across all three dimensionality settings and all machine learning algorithms. Somewhat counterintuitively, the low-dimensional models, which only used daily login counts, had similar F1 scores than higher-dimensional models, and in fact, the low-dimensional model, Random Forest, had a highest F1 score across all 7 days, averaging at 0.84. Higher dimensional models, however, were generally better across a range of decision thresholds, leading to a higher area under the curve. This is further illustrated when comparing the receiver operating characteristic curves of low dimensional models, illustrated here on the left, and high dimensional models on the right, both for the prediction on the 7th day of the trial phase. In the paper, we argue that the choice of churn prediction model and its features likely depends on the nature of the churn prevention strategy. For example, if we plan to deploy interventions with minimal adverse effects, like a push notification reminder, we'll want to maximize the detection of true positives, and it is less problematic if retained users are falsely predicted as churned users. In this scenario, in which a false positive rate of 0.5 is acceptable, deploying a lower dimensional model would be preferable, as it is more explainable, easier to deploy, and adaptive to changes in app and data infrastructure, because we only use a single generalizable feature. On the other hand, if our planned churn interventions have more significant adverse effects, for example, if we offer subscription discounts, a more conservative prediction approach is advisable with an emphasis on keeping false positives minimal. In this scenario, higher dimensional models were better suited as they performed better at low false positive thresholds. The predictive performance of our models can be mainly attributed to app engagement features, with users' daily login counts capturing app engagement effectively, in our case. Generally, when features related to later days in the 7-day trial period, they were more important. For example, for the prediction at the end of day 7, daily login counts collected on the 7th day had a larger effect on the predictive performance than day 6 login counts, day 5 login counts, and so forth. And this was generally the case for all engagement-related features. The static features we included because prior research connected them to app adherence, namely the weekday of installation, the user's weight, and acquisition type, did not significantly improve model performance. A more detailed feature importance analysis, also including app event features, can be found in the supplementary material of the paper. Finally, to assess the potential for targeted in-app interventions, we also examined the number of users who re-engaged with the app on each day following a correct churn prediction by our model on the previous day. In this chart, we can observe that the number of churned users who remained active on each trial day declined over time, as highlighted by the gray solid line. The green solid line represents the number of re-engaged users that our model correctly predicted to churn on the previous day. Across the initial 7 days, the random forest low dimensional model displayed here correctly predicted 80% of these re-engaged churned users. The model was more effective at identifying churned users who would not return back to the app, with a mean accuracy of 98%. Overall, the model correctly predicted an average of 93% of churned users, although given a relatively high false positive rate, averaging at 58% over the trial week. So, given these results, our study indicates that early churn prediction can not only identify fully disengaged users, but also those in the process of disengaging, providing actionable insights for interventions. Thus, we think that churn prediction holds great potential in helping us tailor and adapt persuasive and behavior change systems more effectively, for example, to user profiles, contexts, or behavior change stages that have all received significant attention in the HCI literature. The ability to detect users on the brink of disengagement may also create opportunities for delivering timely questionnaires, gathering feedback on the causes of disengagement in real-world contexts, where this information is otherwise hardly attainable once users have fully disengaged. So this may help us better differentiate between unintended and happy abandonment in remote data collection studies. Also, given that the predictive performance of our models was mostly attributed to app engagement features, this highlights additional benefits of digital health interventions compared to traditional behavioral interventions where such granular data may not be collectible. So, focusing on dynamic engagement patterns rather than static user information for predicting behavior and adaptive systems appears to be an attractive path forward. Furthermore, we outlined that model performances varied across applied machine learning algorithms and features, and that the optimal selection depends on the specific use case. Developers should thus experiment with multiple algorithms and model dimensionalities when creating churn prediction models, considering both model interpretability and complexity. And finally, it must be noted that this analysis was retrospective, so we need more prospective studies to validate the applicability of such models in creating actionable insights. For future research, we are very interested in studying the combination of churn prediction models with targeted interventions or context-aware recommender systems. In the field of digital health interventions, there's also growing emphasis on applying reinforcement learning algorithms to optimize intervention delivery, where our churn risk scores of such models could be used as state features, which could be another interesting avenue for future research. And on this note, I would like to thank you for listening until the end of this presentation. A special thank goes to my co-authors Nils, Lepper, Elgar, Fleisch, and Tobias, Kowatsch for their invaluable contributions and support. And last but not least, I want to acknowledge the amazing team behind Way Better for providing us with the data set, particularly Jamie, Erica, Brian, and Jackie. Your commitment to helping people live healthier and to taking on the difficult challenge of scaling this impact with a real-world product is truly inspiring. Thank you very much.